Hi, good evening, Steve Adler. Got a minute? All right, let's take a look at the numbers. Let's talk about the holidays that are coming up, and let's begin to get real serious tonight. Let's pull up the first chart. Let's look at hospitalizations up at 32, new admissions, 7-day moving average at 32. Those numbers are concerning, and they're concerning on a couple of different ways that we've talked about. Let's begin with the fact that earlier this month, those numbers were about half of what they are now, which means that within the last couple of weeks or so, those numbers have almost doubled. If those numbers double again in the next couple of weeks, we're in real trouble. If those numbers double in the next couple of weeks, then we're not going to be able to stop our ICUs from getting overwhelmed, which means we have to do something in the meantime. Back when we originally did this, we thought we had 340 ICU beds that we could use because we had 340 ICU beds. But the ability to use all those beds required us to be able to get some auxiliary staffing so we could use all the beds we physically have. But now that we've watched things play out in El Paso, where they have run out of room, over 1,000 healthcare workers have been sent to El Paso to augment their operation, not only what's in their hospitals, but what they're standing up. They have no room for anybody right now in their hospitals in El Paso. I was reading the paper, and the doctors are actually having to make choices between who they effectively save and who they don't by the care limitations that they have. That's a horrible place to be. But what that means is that most of the available healthcare workers to help folks staff up to their physical space is in El Paso right now. Ahead of us on the curve, Amarillo, Lubbock are heading toward El Paso, also in just horrible places. Dallas, Fort Worth. Hospitals, I read today, are virtually filled up there as well. Additional medical personnel, staff headed that direction. Harris County is not going to be too far behind. After that, it's us in Bexar County. And quite frankly, at this point, it does not look to me like we can count on having additional medical support coming to us, which means that the only beds we should be counting at this point are the ones that we know we can take care of based on the healthcare professionals that we have here. That number is about 200, as opposed to the 340 we thought we had. So getting up to 32 begins to look pretty scary to us, especially with the speed that it's rising. Speed is not rising as fast as it was in June, which gives us a little bit more time to control our future, which is great. But it does mean we need to start taking a serious look at altering our behaviors so that we can get a hold of this line, so we don't end up looking like El Paso. But that's the 32 numbers. 306 additional cases today. 306 additional cases is again, triple what we were having just a few weeks ago. Those numbers are going up, which is of significant concern. Again, we're going to have to step in and do something here that's different. Take a look at those numbers down at the bottom. Those are the 7-day moving averages for hospitalizations, ICUs, and on ventilators. Let's see exactly what the numbers are tonight compared to those 7-day numbers. And what we can see is the number of people we actually have in our hospitals tonight, 204. 204 is the census number in our hospitals. 32 was the additional admissions, but the number in our hospitals with that, 204. 7-day moving average is 182. In our ICUs right now, 63. That's above the 7-day moving average. On ventilators, 36. Again, above our 7-day moving average. All concerns for us. We've been going through these pages real quickly. 469 people passed away. That's the same number we had yesterday. So at least no new numbers there. I do point out that the number of people that have passed away in the United States, 250,000 we crossed today. 250,000. I can remember when Dr. Fauci back in the spring suggested that we could have 240,000 people die in the United States by virtue of this virus. A lot of people were shocked. A lot of people suggested that could never happen. We've now passed that 240,000 number at 250, and across the United States, that number is substantially increasing. Again, you can expand any of these charts when you look at these dashboards. We haven't done that in a while. Let's take that middle dashboard and just expand it so that you can see it. This shows you weekly hospitalizations by race and ethnicity. The last day reporting for this chart was November 8th, or the week ending November 10th. Latino, Hispanic population is at the top. The white population is the blue number below that, and the gray is the African American population. The Latino number about 41%. The population in our city about 36%. Anglo population just below that, but it's close to 50%. African American population about 14% or so. It's only about 7 or 8% in our city. But what we're seeing now, as we looked at the numbers yesterday, was increased positivity in the Latino, in the African American community. With that increased positivity, if we check back and look at these numbers for hospitalizations in another week or two, I bet we see those disparities once again coming back to us. Let's take a look at the University of Texas modeling so we can see what that looks like. University of Texas modeling has the R number, reproduction number, at 1.12. Remember the days, not a month or two ago, when we were down at 0.5, 0.6. We're now 1.12, which means there's an 84% chance that the pandemic is continuing to grow in our city. And we have 36 more infections now than we had just 14 days ago. You can see the chart shows you the spike that we had back in July. It shows the green indicator off to the right that says we're going to be going up. By mid-December, that's predicting a number that is north of 40, getting close to 50. And what we're told is if we get up in that 50 range and have not begun to change the curve, we get up to 50. It's going to require us to do something drastic, like shutting down, that kind of behavior, in order to be able to stop our ICUs from getting overwhelmed. Remember, if we change our behaviors today, we don't actually impact hospitalization numbers for another 2 weeks. So we have to act. In the first 2 weeks we act, our numbers will continue to go up until we catch up with it. So the chart from the University of Texas tells us that we need to be acting. The governor today apparently went on the news, said that there wouldn't be any more lockdowns in the state. And I've been asked by the media about that today. What I will say is this. We don't have to decide today if we're doing any lockdowns or not, because we have it within our control to prevent us from having to make and confront that difficult situation. If we are mindful, if we do a better job of masking and social distancing, if we don't go out as much, if we don't be in restaurants as much, if we spend more time with the folks that we live with, if we limit the number of people that we are around, if we wear masks in public whenever we're around other people, keep our groups smaller, we can get a handle on this. And that's important, because that's the kind of thing that's got to be necessary to keep schools open. We already saw this week with the closure at Austin High that our schools get in danger as our numbers go up in the community. So we have to decide as a community right now just how important it is that we keep schools open. How important is it that we're able to keep businesses open? Because if that's important, we have the opportunity right now to impact that and to make that happen. If the numbers get up toward that 50 range, we're going to have to do something. We'll have to do something drastic, and no one wants to get there. No one wants to consider what the options and alternatives are at that point. My heart and best wishes and prayers go to the folks out in El Paso. that are dealing with just a horrible, horrible situation out in El Paso, a city that is trying to take steps to close some restaurants, close the bars, trying to get people to stay at home. And the Attorney General has gone to court to stop them from being able to do that. And I think that's real unfortunate. I think that each city and community should be able to make that decision for themselves through their elected leaders. There's going to be a press conference tomorrow with County Judge Andy Brown, myself, Dr. Escott, and Director Hayden. We're going to talk about the numbers and where we are, the modeling, and what we see and what we need to do as a community. And I think the gist of the conversation is going to be that we have it within our control to stop from drastic steps if we're willing to pick it up. And we just have to decide as a community just how important that is to us. I mentioned before, U.S. passed the 250,000 deaths, kind of heartbreaking place to be. Good news today about vaccines. Appears as if there are going to be some vaccines that are real effective. We've already started working in Central Texas to set up the systems where we can get it out just as fast as it comes in. But it's going to be real limited quantities here. It's not going to be till next spring, early summer before it's available to everybody. But we can almost smell the vaccine now, taste the vaccine, almost touch it now. So we just can't lose the discipline. You know, we don't have to hang on forever. We have to hang on till then. We can do this discipline. We have Thanksgiving that's coming up, and it's a concern. And one of the reasons why we need to show discipline is because that is coming up to us. The risk presented from Halloween is great. When people gather at Halloween, they're mostly gathering indoors, which is hard, eating with each other, which means they're not wearing masks, gathering in a little bit larger groups as we try to bring our extended families or our friends together. All of those things present greater risks. Dr. Escott was saying that Halloween is kind of like Labor Day, Memorial Day, and July 4th, all wrapped up together into one in terms of presenting risk. So it would be great if people started thinking now. And I said Halloween, but I meant Thanksgiving. As people gather with the turkeys, people should start thinking right now about how they can make new traditions for Thanksgiving. Spend Thanksgiving just with the folks in your household. Get together with friends or family over Zoom. Understand that outdoor is better than indoor for people to gather. Significant difference. If you're going to be gathering with people, please make sure that you bring supplies for everybody to be healthy. Extra masks, extra hand sanitizer. The best thing, again, is to stay with your immediate household. But if you're going to do more, and it's not recommended you do more, please do it in the most careful way you possibly can. Please consider avoiding contact with people outside of your household for 14 days before you gather with other people to make sure that you don't have an infection and that you've isolated. If everybody did that, then when a group gathered, probably there'd be less risk in that group. So everybody should be isolating themselves. Anybody you're with, ask them to isolate for a week or two before they gather to minimize risks. Minimize gestures that promote contact. I know it's really, really hard, but we shouldn't be hugging people outside of our household. We shouldn't be shaking hands with folks. So I urge everybody to consider doing that kind of thing. Please make sure that you maintain physical distancing and masking around people that you don't live with. When people are together, there are behaviors that increase the risk. Singing or chanting or shouting when you're around people, especially when you're not masked or physical distancing, has a real dramatic impact, which is why people that sing together in choral groups and choirs when they practice, the incidence of the infection spreading much higher, because when you sing or you shout, you increase the potential for droplets to spread. Please clean, disinfect commonly touched surfaces, any shared items between uses, to minimize risk. And then I just want to re-emphasize, please do not gather in person. If you recently were diagnosed with the virus, if you have symptoms of the virus, please, please, please don't get together with other people. Take seriously that kind of risk. If you're waiting for test results, don't gather with other people. If you think that you have been exposed to someone in the last 14 days that has the virus, please don't gather with other people. If you or someone in your home is high risk, please don't gather. I was talking to someone today who is looking at Thanksgiving coming up and Christmas coming up, and was just talking to their mother, who was anxious to see her grandchildren, and the grandchildren anxious to be with her. And there will be so many more Thanksgivings and Christmases to come. Just don't take risk with folks that are elderly or susceptible this holiday season. This holiday, just don't take the risk. Preserve the opportunity for all the Thanksgivings and Christmases to come. This Thanksgiving, I think Diane and I are going to be just the two of us, which will be in some ways nice for a change. I'm sure we're going to be Zooming and talking to our three girls and to their families, but I think it's just going to be us. We're gonna be with people that way. I'm gonna help with the cooking, poor Diane, but we're gonna do that together. It is okay if this year Thanksgiving is different. I mean, this whole year has already been different. And again, I'll just repeat what Mayor Nurnberg says in San Antonio. Social lives are not as important as actual lives. We're going to have to do something in this community to get a little bit more disciplined if we're going to prevent going to El Paso. We'll talk about that more tomorrow. We still have within our control to limit the disruption in our lives, but we got to take it seriously. Start making plans right now for Thanksgiving that will be safer for you and the family and for our community. And with that, wish you good night, take care, be safe, and we'll visit tomorrow.